So my name is Quinn Pauly. I'm a family physician. I live in Reno, Nevada, and I've been a practicing clinician for 30 plus years, and I'm currently the chief medical officer for a big tech company called Switch. Um, and I'm also the president of the Nevada Physician Wellness Coalition, which is a nonprofit organization that we've created here. And yeah, I'm just excited to be here and shed some light.
My name is Colleen Camenisch, and I'm the executive director for the Nevada Physician Wellness Coalition. I have a master's degree in business, and so that's kind of the background that I bring to the coalition, along with spending many years in the world of graduate medical education, also working with med students. And I've worked at a couple of different medical schools. I've worked at the University of Nevada, Reno Medical School, and also UMass Medical School in Massachusetts. And I have felt honored and privileged to work with physicians, residents, and med students throughout my career path. So really happy to be here today.
It's a term that, often is thrown around as kind of a throwaway term or not a definitive term, and it has more recently been recognized as a definitive term, as a diagnosis, if you will. And I think it boils down to physicians being cynical and feeling low sense of accomplishment, depersonalization, not recommending the profession to their kids or their friends, retiring earlier than physicians would have, or change careers more so than our predecessors. So that's kind of what it feels like when it's happening to you. I'll answer it in a percentage more than just an absolute number. But for the last 5 or 10 years, the number has been thrown out there. The percentage that's been published is about 50% of practicing physicians are burned out. Unfortunately, during this last year and a half of the COVID-19 pandemic, that percentage has increased even now with some early reports from research being done on physicians during that period of time. So a pretty high percentage, a high number of the several millions of doctors practicing in the United States. I was very interested to learn that it's not the same for everyone. I mean, even in a hospital system, one group of factors that contribute to their burnout might be different than ones that are on a different floor of the hospital, which kind of thing, which I was new information for me. But I think that the way I conceptualize it is, right now in the 2021, for the last 10 years, there's never been a group of physicians prior to that were exposed to the same factors that we are. And I'm not saying, we're less resilient or more resilient. And older physicians are getting burned out as well and have been for a long time. But it's kind of a perfect storm. There's more, demands to see more patients, and pay is less. There's much fewer number of private practice physicians now. Most of us are employed by a larger organization, so there's this loss of autonomy. And then kind of the rules and regulations, the amount of things that we have to document that many of us feel aren't related to actual patient care, that detracts from our ability to have face-to-face time with our patients. As Colleen mentioned, we don't see other doctors as often, like in the old days when we'd go to the hospital more often. And so it all kind of contributes to like I say, this loss of a sense of worth and accomplishment of what we all went to medical school and aspired to be, these caring, giving, helpers of the community. There's definitely been a loss of that. And all those factors kind of accumulating right now to, like I say, 400, 500, whatever the real number is of physicians in the United States, so that gets so despondent that they actually take their own lives. That is, significantly higher than that of that same number of physicians in the general population would be. So, and it's gender related. Female physicians are even more vulnerable to burnout and suicide than their male counterparts. So I obviously, I'm hearing myself talk. I mean, you can't just put your one finger on it. It's just an accumulation of factors that has, got us where we are today.
And I'll just add a little bit. I mean, it's also hard to know how much of these characteristics like drive someone into medicine in the first place, like this sense of a tremendous responsibility and care for the work that's being done. I mean, you see that across the board with physicians really having this high level of expectations for themselves, for the work that they do, and how that might be contributing. Again, just the sense of Dr. Mick Krasner and Dr. Ron Epstein have written a little bit about sometimes this mismatch between again, being called to a certain type of work and then not being able to balance it out with the other aspects of your life, like work-life balance. If you hold this huge responsibility, how then do you balance out the other responsibilities in your life? And this comes up. I mean, we could see it in medical education as well. Like just getting people food is a big part of well-being when it comes to people either in medical training, residency, and then as physicians. The other thing we know is that physicians aren't always good at seeing doctors themselves, at getting routine checks. So there sometimes are high rates of cancer, even coming out of residency programs, which it sounds surprising, but people just might not be getting screened appropriately, and then having something more challenging by the time it's actually found. So I think there's a lot in the mix, as Dr. Pauly pointed to, that's contributing. And then this, Dr. Pauly already named it, but many people go into medicine to help people, and then not being able to have as much control over time or autonomy, especially as medicine has shifted quite a bit and less sole practitioners out there. It's more and more expensive and difficult to do that. And so it can feel like a loss of control or autonomy as well. I was really, really struck, having worked in lots of different industries, by the altruistic nature of people that went into the field of medicine, especially understanding how intense the path is. And that's not just for practicing physicians, it's the whole journey, starting in medical school. It just really seemed to me that the people that go into medicine are called to that work, and super dedicated, and just the amount of things that they have to sacrifice in their life, including, oftentimes their own families, and the amount of time they get to spend there. And so for me, it felt really like just like a perfect blend of what was personally important to me, and also just a way to honor these people that are doing so much and sacrificing so much to really hold our communities together. And I think in a maybe a unique way this year, we can see maybe what wasn't felt at such a surface level before, that physicians play a huge role in public health and community wellness, and in the service that they offer.
I've certainly not been immune to it myself. I mean, there's been times throughout my career when, I felt that I met the definition of burnout, and even, drifted into some depression. So it's for all those reasons combined, a group of like-minded physicians and myself in Reno got together and said, hey, plan A is not working very well. just, kind of hoping the doctors can snap out of it. And so we decided to create this coalition, this volunteer physician-led coalition, to see if we could, address the issue and of burnout and physician suicide, which is also a very problematic, as you can imagine, issue that we have both locally, statewide, nationwide, globally. And that number is over 400 physicians in the United States commit suicide every year that we know of. There's several more that aren't diagnosed or coded, if you will, as a suicide, but probably were, including, just 4 or 5 right here in our local catchment area, just in the last few years, including this year in 2021. So it's an ongoing problem, and we're here to do our best to be a resource for physicians in the state of Nevada. Burned out physicians are less productive, more likely to make a mistake, more likely to be have a malpractice suit filed against them, more likely to leave the position that they're in, and the cost is very high. To replace a physician that leads an organization probably is in the range of between $500,000 and $1 million when it's all said and done. Not to mention the disruption to the practice, the patients having to find a new physician and so forth. And then the worst case scenario is that the depression or the burnout turns into depression, and then suicide, the symptom of depression. So that's really the magnitude and the seriousness of what it is that we're trying to approach.
But the idea was that we could address basically the devastation and negative community impact of physician burnout and suicide. And our aim was really to try to destigmatize mental health issues or burnout that could easily be associated with this profession, and to start to create a place where physicians felt safe to come together and to share their experiences. And so, yeah, it was formed by Dr. Pauly and a couple of others in the community, really following the suicide of a relatively young physician in our community. And the idea was, can we offer something that's proactive? Like we try to address the whole spectrum of well-being and wellness, from pre-burnout, hopefully, to burnout, to people that might need more resources or might even have suicidal ideation, and to try to make those resources feel safe and accessible. And I'll let Dr. Pauly share more.
We kind of felt like plan A wasn't working. Physicians weren't self-reporting to their local medical licensure board or the hospital that they maybe have privileges at. They were suffering in silence and continue to suffer in silence. So we wanted to create a soft place to land, if you will, where this was coming from people, from their colleagues, not a mandated thing by the state or a medical association or a hospital group. And we've been pretty fervent that we've stuck to that mantra throughout, and I think that's really what differentiates us from more of a mandated thing.
Yeah, and I think I can offer, my perspective as a non-physician and kind of seeing. Dr. Pauly, pointed to the culture of silence, but we know that this is really unique to physician communities, that they take in more of life and death than most people ever will, and that for sure throughout their career they experience trauma, and it's often not talked about. Other healthcare professionals tend to talk to each other and support each other in ways that physicians often, it just isn't a culture that's built in. And so I think that's one of the really important things that we could see as an organization, was to create a space in meaningful ways that physicians could come together and to share their experiences. And so pretty much all of the programming that we do is really centered around that. It's really centered around coming together in meaningful ways, sharing stories, remembering that you have colleagues in the community that you can be in contact with. And we kind of kicked off this programming about 8 months ago, and we just got our numbers in. And throughout the state of Nevada, we have had 625 people register for our courses in just 8 months. And we have a huge physician shortage. So that's we don't know the exact numbers yet. We're still putting together like the percentage that we've captured, but it's a huge amount in a really short period of time. So I think it really shows that there is this need and this desire to want to connect, but really needing a safe place. And I think Dr. Pauly pointed to a place that's not necessarily at an institution or connected to, licensing, a place that feels truly for physicians by physicians, truly safe, and a place where people can really connect with each other.
So we have a physician and a physician family resource line that's free, that doctors or their physician families can call and speak to a licensed psychologist that's versed in this issue, and just kind of find out what their resources are, realize that they don't have to suffer alone. And again, real important that the families be aware so that they can call the resource line as well, because often it's the family members that are suffering as well, or they're the first to know and they're told not to say anything. So that's kind of the most important thing I think we do, is that we have that resource line that is available to physicians throughout the state. And it's not a suicide hotline. There are those lines that exist, but we don't have the bandwidth to have that at this point, but it's more of a resource line that's, we'll answer in a short period of time. And then Colleen is responsible for a lot of the educational things that we do. We have a monthly speaker series that will have guest speakers come and talk about an important aspect of this issue. She runs some humanism and medicine several month-long classes. We do have someone that comes from the Nevada State Suicide Prevention that gives talks as well. So that's kind of what we're all about, is raising awareness. Truth be told, the resource line is underutilized. Even though physicians now are learning that it exists, it's often not until there is a physician suicide in town or nearby that then we get a bunch of calls. But we want that to be utilized more. Obviously, prevention is way better than waiting till after an event. And for every physician that commits suicide, there's hundreds and hundreds that are suffering. The U.S. healthcare system is broken in a lot of ways. I don't think it's focused enough on patient care and what we all need to do to improve, patient care and patient satisfaction, patient outcomes. So, I think the electronic health record conceptually is a good idea. I mean, medicine tends to lag 10, 15 years behind other industries when it comes to, digitalization. And, we all used to have paper charts when I first practiced. But unfortunately, the utility of the electronic health record, the digital version of your patient's chart, they're often not easy to use on a daily basis, not particularly intuitive, and a lot of time spent clicking on a keyboard and a mouse when we could be having face-to-face time with our patients. again, because of the rapidity, X number of patients we're asked to be seen an hour. It's not possible to give even halfway decent care and do all the charting at the same time. So we tend to take the charts home with us, and I've said this before, pajama time, where we put the kids to bed and then we're still sitting in our bed typing away on our laptop to finish the notes for the day. So it just that work-life integration is just out the window. So I would love to see the healthcare data problem solved, where there was more integration, more user-friendly versions of what we do, and not have the complete onus of that all the charting be the physician's responsibility. Some of the things that don't directly impact patient care could be done by others. But it's a huge problem. I mean, I don't know, there might be 1,000 different electronic health records that a physician could choose to use, or that a hospital system uses. And I'm on the board of the Health Information Exchange in Nevada, that's trying to tackle this problem to make the ease of data transfer between organizations greater, so that if you end up in an ER somewhere else, you don't have to start all over again with your health history.
And Dr. Pauly, I'll add just a couple of things. There was a hospital system in Indiana, and I wish I could remember specifically which one. But one thing that they did was they brought their IT department together with the physicians to figure out, like, what are some of the most common things that are challenging. And one of them that they found that made a huge difference for clinicians, and it sounds super small, was that they didn't have to type in their password at every computer. They could just have a badge that logged them in and out. And just that simple removal of that they might do 100 times a day made a huge impact for the physicians. So I would say don't underestimate, bringing the two worlds together. I think Dr. Pauly is really pointing to that, and what small solutions might be able to make. Sometimes we're thinking about such a huge system, and it might be like a behemoth to change or to integrate, but there might be small things that make a big impact. And the other thing that I would say is that, one of the things we know, like one of the ways you might notice burnout is charting errors. And so again, this is like for physicians, a place where if there is burnout happening, it might be one of the first places to have a conversation, like Dr. Pauly said, really having those relationships with the team, and just to check in and make sure someone's doing okay if that's arising.
Yeah. Another thing, a similar story. What's one of the big hospital systems in San Francisco, at their ER, they said, okay, we want the doctors at the table when we make these IT decisions, because they're the ones that are kind of the end users of what we're using. And then also staffing, like I said, medicine, the margins for keeping your clinic doors open are pretty small right now. And so, if you don't have the right team, I mean, there was a study that came out and said, hey, guess what? If you have 2 medical assistants per doc, you get more done. The patients are happier. They have a person assigned to them for a longer period of time. The doctors, like you say, that some of the other charting things and stuff can be done by more than one person compared to one. I mean, it makes sense why that would happen, but again, convincing an organization to actually hire that second person to staff the clinic, that's a money decision, but there's science to prove that that's the right decision to make. But again, if you don't have good communication, if you're not paying attention to the factors involved and asking the questions, then the problem is going to continue. When it comes to the individual practice manager that may be listening today, I think having a good relationship with the physicians, making the physicians feel like they're involved in some of the administrative decisions when it comes to patient care, work-life balance, I think that open line of communication, I think, is important. And also, the better you get to know your physicians, the more likely you're going to be aware of, like, hey, Quinn fell off the rails. What's going on? He's not acting the same as he did before. You'll be able to notice those things more. And but again, that's a big challenge. The physicians are often their worst enemy. You graduate from medical school, I think the numbers upwards of $200,000 in debt, which means some docs have $300,000 in debt before they even, see their first patient as a licensed physician. So they're probably volunteering to do more shifts and things, knowing, even though in reality that's going to be, detrimental. So I think just open communication and, mutual respect.
So one of the most challenging things for a physician when we offer wellness options is that they then again have to give up some part of their personal life. And so I think when you're really thinking about integrating wellness and wanting to officially support physicians, creating work time, dedicated work time that they could actually take to do that, rather than having it be something in addition to their day, because it is the work that's creating the stress in their life. And so it's like, but somehow the task is on them outside of work then to deal with the stress. So I think that's one way that's really challenging for systems, but really beneficial for physicians.
Yeah. I also think, at least in Nevada, what we're trying to do is, have refrigerator magnet that, has the, Nevada Physician Wellness Coalition.com and the resource line. And so I think if practice managers were aware of what their local resources were and were, repetitively making those resources known to their clinicians, that would be a big step in the right direction.
And I think, Dr. Pauly, you might not be thinking about this because you're that person, but having someone in the institution that's already a wellness champion, like Dr. Pauly was like that before the coalition started. And I think, at least from what I've seen, your colleagues naturally reach out to you. And so having someone in the institution, we found that at every hospital system we go to, is super helpful. And someone that will like immediately, every time Dr. Pauly shares his story, it destigmatizes the issue. And then all of a sudden people start coming out and asking questions like, am I burnout? And can I just connect with you? And so I think, having those people that might already be champions and engaging them is super helpful.
Oftentimes that isn't the case. It's like, in medical school, it's like, hey, you're going to be working long hours and up all night studying for the boards and things. That just suck it up. That's just the way it is. And but we think we're superhuman, but we're not. We're just human. And so sooner or later, those things take their toll. And the same thing is, again, when you're working for someone else, it's like, hey, I don't want to show my vulnerable side because that'll, it'll make me look weak or something. And we're the caregivers. We couldn't possibly be sick ourselves, and we just need to change that mentality. And across the board, even from the patient perspective, realizing that a mutual respect in that department. So there's a lot of work that can be done. There's a lot of work that I think that we're doing already, and I'm proud of the awareness that we're raising to the issue here in Nevada, and the way we've done this completely independent organization. And we're not aligned with any of the hospitals or insurance companies or big groups. We've maintained our independence. We offer our services to those folks, but I think that is going to increase the likelihood that a physician who's struggling is going to reach out. And if another state was asking, what can we do, I would say, well, you can follow our model in that respect, that we kept it independent, because again, the likelihood that a doctor is going to self-report to the board or to the hospital or to someone that's in control of their license or their paycheck is just pretty low.
If you're interested in checking out our website, it's Nevada Physician Wellness Coalition.com. We also have a presence on Facebook and LinkedIn, so we'd be very happy if you followed us there, and we try to put a lot of good information there. If you go to our website and you're interested in getting our newsletters as well, you can subscribe. And then, of course, we have our resource line. As Dr. Pauly mentioned, it's a warm line. It's not a crisis line, but a resource line for folks in Nevada. That number is 775-404-3307. And we're always happy to receive donations as well. That's the fuel of what keeps us going and helps us keep supporting all the caregivers. We have a Care for the Caregiver campaign, so you can find that at our website as well.